Welcome to Everyday Entrepreneurs Everywhere with your host, Chris Parker.
And welcome to Everyday Entrepreneurs Everywhere. This is Chris Parker, and I have a member of Cobra from G.I. Joe with us. Well, maybe not, but I know he's doing something with Cobra. It's Jeremiah Degenhart, who's in the U.S., and he's the Vice President of Translational Oncology and Bioinformatics. And I'm
There you go, you
really
got it.
hoping to discover what that is during this conversation. And full disclosure, Jeremiah is a beloved brother-in-law, so in the family. And one of the joys about this podcast is I talk to people that I've known for years and years and years and discover things about their lives that I never knew, because when I'm over in the US and we're doing holidays or things, that you never get to this kind of level of detail. So I'm really interested in what's going on in Jeremiah's world and in this professional world. So Jeremiah Degenhart, thank you so much for joining. Can you share with us, what is it that you do and why do you do what you do?
Sure. So I think even people in pharma have not a great idea of what translational oncology is or bioinformatics and what it is that we really do. So basically, when you're developing a therapeutic for anything, for any indication, oncology or, inflammation or something, there's a lot of research that goes on. Most of that research is done in animals or in vitro, which means in cell culture or something like that. You develop hypothesis around how the drug works, called the mechanism of action. So how does it work? And then at some point, after you have enough research data and enough safety data, you go into humans. And that step from going at the research level to taking that drug into people, there's a lot of things that are different about a living human than is in either the animal models that are used or the in vitro systems that are used. And translational oncology is basically trying to take all the data that you've learned in research and translate it into what we think is going to happen in humans. And so it's trying to predict how is the drug going to work, and then trying to collect data during the clinical trials to be able to evaluate if the drug is working the way that you think it's supposed to work. So the things that you're collecting are, blood samples to look at what's called pharmacodynamics, PD. And this is measures of some protein or chemokine or cytokine in the blood that tell you whether or not the drug is working the way that you think it should. I think, there's a large challenge to drug development. I think the majority of drugs fail, and they fail in phase 1 trial. And it's because of this aspect. And so, not knowing exactly how it's going to work once you get into people. So, the translational portion is essentially trying to minimize that failure of drugs in phase 1, phase 2 trials. So making sure that we have enough information going in to know what it's going to do, and making sure we collect enough information while we're running it to make sure that we still, understand it the way that we think we do. So that's the translational aspect. Bioinformatics, I think informatics is basically taking large data sets and using them to come up with, to learn something. So gleaning information from large sets of data. Bioinformatics is basically the same thing, except you're in the biological world. So you're taking, genome sequencing, proteomics, large data sets that we now have the ability to generate and translating that into information. So taking, on a program that I'm working on right now, our first drug that's going into the clinic, we're collecting what's called circulating tumor DNA. So as tumors grow and expand, some of the cells are dying all the time. Those cells release DNA into your bloodstream, and you can actually take a blood sample from a person and detect tumor-specific mutations in the DNA that's circulating in the blood. And you can use this as a way to monitor how the tumor is responding, so whether or not it's shrinking or growing. And so that's an aspect of that. And the data analysis around that is the bioinformatics, and essentially developing algorithms to be able to predict things like that.
Are those two things related? Meaning, do you do the translational oncology with bioinformatics, or are those two different worlds?
They are two different worlds that often come together. So in most companies, I think they're generally two different departments. My background is in computational biology and bioinformatics, and so that's where I started from, and then I moved into more translational biology. Not everyone working in translational has a background in bioinformatics, but because the types of data sets that we're using, especially these days with next-gen sequencing and these sort of large omic data sets, which is sort of global data sets that we use on people, it definitely helps to have an understanding of bioinformatics.
So the translational oncology part, does that mean you're using large data sets to try to anticipate what would happen in a human before phase 1 trials? Is that the trick?
So that's part of it. So there's actually translational oncology spans a wide range of things as well. So there is the sort of forward predictive translational. So this is taking data sets from research and trying to predict what's going to happen. There's retrospective analysis, so you're collecting the data and then analyzing it after the fact and looking for things. And so it incorporates both of those. It's both sides of taking the research data and trying to predict what's going to happen, taking the trial data and trying to see if it actually matches up with what we think happens in research. So it's both forward and reverse translational.
And why are you busy with this? Of all the things in the world that you could be doing, because I know you do other things as well. The pictures I see online are usually collecting like salamanders or things, or making homemade knives, or I have
a lot of side hobbies. It has been a non-linear path to getting to where I'm at today. I grew up in Spokane, Washington. I was actually homeschooled starting in the second grade. Didn't have a sort of, well, my family's fairly, traditional religious family, lower middle class Spokane. And so I didn't really have an idea of college, what options were out there. Definitely like to go out, go camping, go, collecting salamanders and playing with bugs and things when I was a kid. So when I started looking at college, my initial plan was to do something in like Forest Service or, something where I could get out and do that. I started in the community college in Spokane, taking just some basic courses, realized that I was, pretty decent in the biology classes, doing pretty well at actually doing math as well. And so there started talking to some of the professors at the community college, and they suggested, if you really want to get into biology, then you're going to have to go and get a PhD, which seemed kind of absurd to me because no one in my family has more than an associate's degree before I started school. So the idea of a PhD was just like, I have no idea what this even is. And so then I transferred from community college to the University of Idaho, again, focusing on zoology at the University of Idaho, so focusing on biology. Before that, met my wife, Angie. She's also was in biology. And when we were talking to our professors at the University of Idaho, one thing that they mentioned is, if you're going to go into academics, which is sort of what everybody thinks you're going to do if you're in biology, there's not a whole lot else out there, that you need to sort of diversify so that you can find positions at the same university.
Wait a second. Wait a second. The timeline is all off for me here.
Okay.
You met Angie in Idaho.
Actually, in community college, right before we moved to Idaho.
Okay. Because
in Spokane.
Yeah.
That's where we met, at the community college. And then we moved to Idaho. Actually, she moved first, and then I moved to Idaho right afterwards.
Nice. Okay. It's
okay.
Together. Yeah.
Okay. On track. So getting a zoology degree in Idaho, decided we needed to diversify a little bit. I had been taking more and more math courses. And so I started looking into bioinformatics and computational biology at that point, as a way to just sort of diversify. And so applying to grad school, I decided to go completely into a theoretical field and went into Cornell in a PhD in computational biology with a major focus in population genetics and genome evolution. And so, and then Angie started at Cornell in more ecology and evolutionary biology, more, hands-on bio. And so that was how that started. And then after 5 years of being at Cornell and being poor because, we were, had 3 kids at that time, and paying for 2 of them to fly back across the country to come visit their father. We needed to do something that made money. And so because of moving into bioinformatics, there was the whole sort of field of industry research for me that had opened up. So when I graduated with my PhD, I looked at essentially 3 postdocs, 3 industry positions, and had to make a decision of, do I want to continue to be poor being a postdoc, or do we want to take one of these fairly nice offers in industry? And the first offer that came back that was solid was from Genentech. And so I decided to take it, moved to the Bay Area, and started working. At that time, it was more specifically bioinformatics, developing new algorithms for genome sequencing data analysis, but in oncology, and specifically sequencing genomes from cancer patients and looking for changes between those genomes and, their normal DNA to try and develop new therapeutics. And so that was about a decade ago. And that's sort of how I've been then just sort of continuing through this path.
So just to challenge, not so politely but bluntly, is what's the drive? Because yes, there's certainly money here, but also knowing you a bit, you seem to be turned on by this greater puzzle of things. Or what's your
So
basically what you said was a very rational sort of progression. Although so what kept you ticking down this path?
Initially, I think one of the areas that I was really interested in, so you have 2 different genomes in your body, really. You have your germline. This is the cells that, you generate, they make your offspring and transmit your DNA on and on down that sort of that path, right? You have a whole nother set of cells, which is the rest of your entire body. These are called somatic cells. And somatic cells mutate over time as just part of the normal process. So if you take and you sequence a cell from your hand and a cell from your foot, they're not going to look exactly the same. There's going to be multiple differences between them. And there's mutational differences, and then there's the sort of RNA differences, expression, protein differences between those that give you the different phenotypes. Part of that process is something called duplications and rearrangements. So large chunks of the genome actually come out of the genome, go back into it in a different place, or duplicate from one place in the genome and into another place. And this is happening all the time in your normal cells. And so during my PhD, and actually even before that, so salamanders have really crazy genomes. Some of them are, tetraploid, meaning they have 4 times the number of chromosomes that we have, and other really odd things like that. So in my PhD, one of the things that I was looking at is sort of how do you understand differences in phenotype based on these large genetic changes. And so population genetics and genome evolution, that's really what I was looking into, was how do these changes in the genome translate into actual phenotypic changes across, and can we see correlations between these? So when you're doing that studies like that, you're basically sequencing tons of genomes and then trying to correlate back with the phenotypic information that you have. It's not a huge leap to go from there to then, some of these mutations lead to tumor genesis, or the development of cancer. And so when I moved to Genentech, that was a lot of what I was focused on. It's what are the actual base level changes? What are the main changes that are actually driving tumor genesis? And I think from there, it's, not a huge leap to understand that there are a lot of mutations that are happening in your cells all the time. Most of them are non-functional. Most of them don't do anything. There are a few that do. How do we actually differentiate the functional mutations from the non-functional mutations? And in oncology, they're called driver mutations. So these drivers of developing an actual tumor. How do you find the mutations that are the ones that you actually need to worry about if you're trying to treat cancer? And so I think that's been sort of the common theme throughout, is sort of this idea of genomes evolving and how do they evolve and what are the functional changes, how do you identify them?
And so Genentech 10 years ago.
Yep.
And now you're working with Maverick?
Maverick Therapeutics. So this is my first dive into a startup company, a very small company. So I guess my progression through, I went from Genentech to another company called Onyx Pharmaceuticals. At each place, after Genentech, I learned a lot about bioinformatics and industry there. At Onyx, I came in to actually start the bioinformatics group there. They were, at the time that I joined, had just completed a phase 2 trial. And so they had a ton of sequencing data from the phase 1 and the phase 2 trials. And they were trying to understand why some patients didn't respond to their drug. And so I was developing sort of the computational infrastructure and analysis to be able to try and do that. We got bought out by Amgen. I left shortly after that. Went from there to Gilead, where I was also doing sort of the same thing of starting a research bioinformatics group, or helping start it. I was one of 3 people that was working there, and doing sort of the same thing of genome analysis, both the sort of forward translational aspect of taking research data and trying to predict into humans, and the reverse translational of, we had a couple of drugs where a fairly large group of people didn't respond and they wanted to understand why. And so trying to do that, was there for a couple of years and then decided to take the leap into a startup where it would have, a little more direct impact on what the company overall was doing. And I could gain more experience on both the corporate side and the sort of scientific side of things.
And is this where the Cobra project comes into play? Is that part of?
So Maverick, I started about 6 months after the company was formed. Let's see here. This is going to be mildly complicated as well. So there, in oncology therapeutics, a very promising area of research right now is around immunotherapeutics. And this is using your immune system to attack cancer cells. There are a few different ways that people do this. The earliest way was just to take and make synthetic antibodies that attach to a cancer cell. Antibodies have a domain on them. It's called the FC domain. That actually attracts T cells and B cells to attack whatever it is through a mechanism called antibody-directed cytotoxicity. So that's one aspect. The next aspect is what's been coming out a lot is CAR T cells, or these are essentially, they take your T cells out, they engineer into it a specific thing that binds to a tumor in those T cells, and then they put the T cells back into you to try and attack cancer. Another one is called bispecifics. So these are engineered antibody-like proteins where one arm binds to the CD3 domain on T cells. So this is the domain on the T cell that would normally bind to some sort of, bacteria or non-U protein. And the other arm binds to a protein found on a tumor cell. And so you can essentially bypass the normal function of a T cell by doing this and cause it to kill whatever cell you want. So it's called redirecting T cells onto whatever cell type that you want. So we are working on one of these redirected T cell killers. It's a bispecific. They are extremely potent, and because of that, in solid tumors, so things like pancreatic cancer, colon cancer, the issue has been that there are very few mutations on proteins in the tumor to actually be able to specifically target the tumor and not hit healthy tissue. And so because of that, essentially all of the bispecific programs that have come before in solid tumors have failed. In hematological cancer, something like ALL or lymphoid cancer, you can essentially kill all your B cells and you're still okay. You'll regenerate more B cells over time. So if you have like a B cell ALL, you can kill that whole population of cells, the tumors and the normal cells. They'll regenerate. You're fine. You can't do that to your colon. You can't do that to your liver. And so because of that, what we're developing in COBRA, this is a conditionally active, COBRA is actually conditionally active, redirected killing. And so it's the CD3 portion, the part that binds to the T cell, is actually masked in the prodrug therapeutic. So in the initial protein that we generate, it can't bind to T cells. It can bind to tumor cells. If you think about a tumor is sort of like a wound that doesn't heal. It's always growing. The tissue's not really doing what it's supposed to. And so there's a lot of restructuring that's going on. All of that restructuring is due to something called proteases. So these are proteins which actually cut other proteins. And so we use that aspect of tumors, the fact that they have upregulated protease, to then cut off the portion that's masking the CD3 binding in the tumor. And so now once this protein that we're generating, the bispecific, gets into the tumor, binds to the tumor, the proteases cleave off the masking domain. Now it can bind to a T cell and kill the tumor. And it does that more directed at the tumor than it does in normal tissue, because in normal tissue, that protease aspect is highly regulated. So it doesn't cleave it as easily in the normal tissue.
It sounds like it's a total journey of discovery. It's like you come up with one idea, and then hey, that could be, but there's an obstacle, meaning we can't target that. And then that's
pretty much science, right? Like we're built. I think which one is it? It's Carl Sagan. We're standing on the shoulders of giants and moving forward, right? Like that is science. Is you take things that have been learned and try to combine them together to take the next step forward to try and develop something that hasn't been developed before. And we're getting very close. So we're taking, in February next year, we plan to go into the clinic with our first COBRA molecule.
Into the clinic means humans?
Humans, phase 1. So this is safety, looking to see whether or not it's safe in humans next year.
And what do your translational models say? Was that human going to
so far
respond well?
Pretty good. Yes. I mean, oncology therapeutics is always extremely challenging. I think the majority of them fail. 95% fail in phase 1. So you can't ever be too certain. But I think that the data looks extremely promising.
Now, what would happen if it succeeds? If it goes through all the phases and gets greenlit and people benefit? Like, what is the population of humans that would benefit from this?
The first drug that we're going after is targeting a protein called EGFR, epidermal growth factor receptor, and that protein is upregulated on a wide variety of tumors. So our initial phase 1, phase 2 trial that we're doing is targeting head and neck cancer, non-small cell lung cancer, and colorectal cancer, which are 3 huge areas of cancer. And then, if it is successful there, we can actually continue to expand into other types of tumors. So I think, one thing that a lot of people don't realize cancer is not a single thing. It's a whole diversity of different types of cancers. Every one of those is slightly different because they come from a different set of normal cells, right? The normal cells contribute the majority of the biology of that cancer type. So we won't be able to hit all cancers. There's never ever going to be something that's a cure for cancer. But there is a good chance that we will be able to treat a large fraction of solid tumor indications. So, just with the three that I rattled off there, the head and neck, lung, and colorectal, we're probably, if we were to move later on into frontline therapy, that's something in the order of 30% of tumors, of solid tumors.
That you could resolve.
That you could potentially resolve, yes.
That's incredible.
Yeah, so hopefully it will be good.
So I'm curious, and I know you work for a company, and we've mentioned the name of the company and stuff. And how much is the benevolent, benefit of humanity part of the daily grind at work? Like, ooh, we're saving the world, as opposed to we're doing math or money. I think how do you balance all that?
There, I guess it depends a lot on what area of the company that you work in, right? Like if you're the CFO or if you're, on the financial side, you're mostly thinking about on the day-to-day basis, are we actually, on budget, hitting it? Are we doing this right? If you're in research, it's definitely a huge portion of it, right? Like, everybody knows somebody who has, suffered from cancer, died from cancer. So we all have, somebody that we're working for in that way and thinking about when we're doing the work. It is challenging sometimes to keep a focus on that when you're digging through, especially in translational, you're sequencing people's genomes and looking at changes when you're actually doing the data analysis. Sometimes it's just A's, C's, T's, and G's that you're looking at the genome sequence and thinking about how does the stats actually work to be able to come up with a correlation. But, you definitely step back and think, hold on, these are actual people. These are actual, animal models that we were using. Somebody was suffering from this. And I think for me, the big time when this comes up, going to conferences, in oncology, and you're sitting through a talk and there's at the end of a trial, the main output is essentially a Kaplan-Meier curve. So the Kaplan-Meier curve is generally, if you're looking at a drug versus a placebo or something like this, it's two different lines. Those lines are dropping over the whole thing. Every time it ticks down by one notch, that's a person that died. And you look at essentially the difference of how many people died on the drug versus how many people died not on the drug or on the placebo or on standard of care or whatever it is. And, when you go to a conference and you're seeing these Kaplan-Meier curves over and over, like it can be really depressing, especially when you're in solid tumor oncology areas. We have a lot of drugs now that prolong life. There are very few drugs out there that actually cure people's cancer on a large scale. Some people will definitely benefit. Some people are cured for some amount of time. Most people do relapse eventually. And so when you see these things over and over, it definitely, for me, hits home that what we're doing is really, I want those lines to be flat. I want them to continue out. And they don't. And you're just looking at these are a lot of people's lives that are being, ended by cancer.
And it must feel good to be contributing to a potential solution for that. But there's probably armies of people out there, because you said 95% fail the phase 1 trials. So there's just a huge amount of investment going into this stuff. But I hope each of these failures is also a learning moment. Meaning how do you talk with peers and say they just burnt a bunch of time and cash and then poof, but then but there's learning there. How is that
I think
sort of moved around?
That is one of the areas in industry that a lot of information is published. A lot of it goes into scientific journals. Successful phase 1 trials are essentially always published. When something works, great. Non-successful ones are not always published. And I think this is where there's the sort of interaction between the sort of world of intellectual property and that these are businesses, they are trying to make money, and the world of science trying to move forward kind of butt heads at times. And I think that is a challenge. I think that there is some aspect of wasted time, wasted energy on programs that we could have known would have failed if there was more sharing of data around. And I mean, there is a lot of data sharing, but not as much as there could be. And part of that is sort of the intellectual property or, corporate trade secrets and things like that. I think it's a challenging aspect of it. And that's, for me, at least one of the areas that, does make it difficult sometimes when I think too much about that, as far as like the career path that I've chosen, right? Like, yeah. I think there is an aspect of that, that I would also, I think one of the sort of grand, down the road, ideas is coming up with ways to actually change that. And, I think, moving more towards something like, sort of pharmaceutical companies being public benefit corporations or something rather than for-profit, strictly for-profit companies is something that I think about. But yeah, that's definitely, that all comes into that sort of idea there.
So starting to wrap up, and I'm also curious if you have any questions back for me before we really wrap up. When would the COBRA program, like if they win all the different trials, when would it win? Like, so if people wanted to put a mark on their calendar to check back in with Jeremiah, is that?
It is extremely difficult to predict that, but so basically the way that it works traditionally in pharma development, you have a phase 1 trial, you have a which is basically looking at safety. Is this safe to put in a person? You have a phase 2 trial, which is, does it do what we think that it's supposed to do? Do we have enough data to show that it's actually beneficial to people? And then you have a phase 3 trial, which is it more beneficial than what already exists? Is there any improvement in patients' health from giving them this drug over giving them any other drug that we have out there? Phase 1 trial takes around a year or 2 years, depending on how that goes. Sometimes they can take up to 5 years if you're having to dose a lot of different people, and it's not really clear. Phase 2 trial, again, takes a year or 2. Phase 3 trial can, depending on the endpoint that you're looking at. So if you're looking at overall survival of patients or progression-free survival, so how long do they survive without the tumor progressing, it can take around 5 years, depending on what the trial is. And so you're talking close to 10 years from the time that you first go into people before you can have an approved drug that now is just being prescribed to anyone. The FDA has been working on ways to sort of speed that up. And so there are multiple different mechanisms now for fast to approval, where you can essentially take data from your phase 2 trial and try to get an early approval. The company still has to run phase 3 trials. They still have to show that the drug does do what it's supposed to do, but you can take that early, smaller data set and go into people sooner. And so it's a way of sort of speeding that up, taking it from 10 years to maybe 5 years before you can get into the clinic.
But I guess the, like any business, it's a bit of a game, it's a bit of a gamble. And
yep.
With the benefit also for people, but also financially, yeah, then you invest in this kind of work. So,
yep.
Outstanding. If people want to learn more, because I remember a couple months back, I know we're in Corona time, so it could have been a couple years ago. There was
Who
a
knows?
a video that was sent out at some point
Yep.
that sort of described the Cobra. I'd love to find that back and put that as a link on
So
the show notes.
I think I gave you the Maverick Therapeutics, the link to the webpage.
Yep.
If you go there, go to, I think it's at the top in science, I think, up at the top. You should be able to click on that, and that should take you to the video.
Okay, see, MaverickTX.com. And then on the top, there's technology, and then
there you go.
therapeutic platform, and there's the video I see in there. So I'll put the link on that into the show notes as well. So outstanding. Well, I can't say that I comprehended everything, but I think I followed enough. One thing I definitely understood somewhere that you said that the whole octopus family is actually extraterrestrial. That's what I picked up from this whole conversation. So I hope I got the right message out of all this.
Yep, that's in there somewhere.
It must be in there somewhere. But you could probably tell me that, because you could probably, you've been analyzing salamanders, so you've probably done that with octopi as well.
The data is out there. We can look at it.
The data is out there, so right on. So Jeremiah, thank you so much for joining. But wait, before we go, you do also, you said you had a lot of hobbies, and one of those is creating knives at home. So handcrafted knives. Give me 30 seconds on that. What's that all about, and how can I order them?
Well, right now I have not been making them because the whole getting ready for the clinic has been pretty busy. But generally, I started, I honestly still cannot remember exactly what the impetus was to start doing this, but at some point I started making knives. There's two different processes for making knives. One of them is called grinding. So you grind a flat stock steel into a shape, put an edge on it. That's a knife. And then the other one is forging, where you actually take a hammer and beat the steel when it's hot into the shape that you want, and then, smooth it and whatever. And so I've been doing both of those. Built a little shop down in the garage down below me right now. There probably still is an Etsy shop for my knives. I started selling some just because I had so many at one point. But yeah, it's been a little while. I need to clean up the garage, clean up the shop, and make it so that I can get back in there. Right now, we've been doing a lot of work on our camper trailer for going camping, and so that's been taking my spare time working in the shop to do that instead.
And the camper trailer is not the Millennium Falcon van. That's something else.
It's the one that attaches to the back of it. The Millennium Falcon van is also taking a fair amount of time of building the Sprinter van and redoing the inside of that. So
you guys are always doing.
Yeah, I like to. Yeah. I think it's because I do so much work on a computer. It's nice to go and do hands-on, actual, real-world stuff. So between that and then photography with going out and still getting out in the woods and seeing salamanders and insects and things, and trying to take pictures and do that.
Well, next time you get in the shop making knives, there's two boys over here who would love to know how to order or receive those. And then there's a mother over here who won't appreciate this, but let's do it anyways. And
I can make kitchen knives too.
Ooh,
there's chef knives. There's whatever we want too.
Well, Nate, the other day, because they had these wooden swords, and apparently they've been beating the hell out of them, and they were all splintered. Nice. So he was skating, and he even said, "Papa, I need a knife that's sharp that I can, do this better." I'm like, "Well, I think we know where to get those things." So
there we go.
Right on. Yep. So Jeremiah, thank you so much for joining and sharing, and I'll put a link to the Cobra program on the show notes at ebullient.com/podcast. And thank you so much. I really enjoyed it.
No problem. It was great. Good talking to you.
Learn more at ebullient.com/podcast.